Another frequently asked question is, what side effects of treatment will I have? And again, that depends on the treatment. If we're talking about therapies directly to the tumor, like ablation or radiation or chemoembolization, oftentimes it's symptoms and side effects related to collateral damage in the rest of the liver. As you can imagine, when we're trying to treat a tumor that's inside the liver, we have to do some treatment around the liver that's around the tumor. And so we always get some non-tumor liver that's also affected by the treatments. People can then get symptoms related to their liver having dysfunction from the treatment, like fatigue or jaundice, or they can have fluid buildup in their abdomen, like ascites. The risk of that happening really depends on how good is the liver before we do the treatment. For someone whose liver is functioning very, very well, oftentimes they will have no symptoms after of their liver dysfunctioning after the actual treatment. But if someone's liver is already struggling a little bit, and then we do some treatment to the liver can start to struggle, and then we have to address those symptoms that patients may get. Sometimes as we're doing these local treatments like ablation or radiation or chemoembolization, we may have problems with pain or nausea as the treatment is actually working. And usually that doesn't last for a long time. Usually it's a couple of weeks or maybe a month at the longest. The systemic therapies that we use, the medicines that we use for more advanced liver cancer, of course, they have more side effects. The medicines that are called tyrosine kinase inhibitors, which are pills that we use for the cancer, those side effects can be things like diarrhea, fatigue, poor appetite. They can cause skin rashes, and they can also affect your blood pressure and increase your blood pressure. So when we're using those medications for patients, we see them very often in the office, and we talk about what symptoms they may be having, and then we adjust the dose or treat their symptoms so that their quality of life is maintained while they're actually getting these therapies. We also use medicines called immunotherapy, which are medicines like nivolumab, atezolizumab, or pembrolizumab. Those are just some examples, and there are several other immunotherapies that we use. Those therapies, the way that they work is they actually turn on the immune system so that our own immune system can start fighting the cancer. Well, sometimes when the immune system gets turned on to fight the cancer, it may also get confused and fight other things in our bodies. So we may see patients where they get rashes, like eczema type rashes, or other GI side effects, like they get a colon inflammation and get colitis where they have terrible diarrhea. Or it can affect their endocrine system, where the immune system now can affect the different organs in our endocrine system, like our thyroid or our adrenal glands. And then we have to give people hormone therapy to help with that. Thankfully, the immune system related side effects are relatively rare, but we always are watching very closely for those because they can be quite severe.